Thank you, Barry. I would like to extend a very warm welcome to all today. Welcome to the University of Virginia School of Medicine, and also welcome to the class of 2017, all the parents, relatives, and friends that could attend. As the president of the Medical Alumni Association, representing the students, graduates, fellows, and the current and former residents and faculty of the University of Virginia School of Medicine, a group of over 12,000 throughout the United States and world, I'm proud to tell you that this white coat ceremony is generously supported by many of your fellow alumni. What you may not be aware of is that in addition to the memorable occasion, the Medical Alumni Association hosts numerous student events and services throughout the academic year. These include Money Talks, our 4-part financial planning series which addresses topics such as budgeting, credit scoring, investing, and home ownership. Family Day, which is scheduled this year for October 12th, in which all the first-year medical students and family members are invited. This event includes an update from the dean, a mini lecture, and a tailgate lunch at the Medical Alumni Association headquarters. The Alumni Women in Medicine Luncheon is sponsored by one of our graduates in the class of 1968, Dr. Mona Reed. The UVA Med Connect program, which is our student alumni mentoring program. Students are exposed to a diverse group of medical alumni from the Charlottesville area that are in private practice. Additionally, there are opportunities for preceptorships with these physicians for practice shadowing. The HOST program is a program which matches fourth-year medical students who are interviewing in various cities to one of our host cities with a medical alumnus from that city. The program benefits both the student as well as the host, and it provides financial assistance through housing and meals while connecting the alumnus with the School of Medicine. Last year, we were able to match over 100 housing requests from our fourth-year students with a volunteer base of nearly 200 alumni across the United States. Our Global Health Travel Awards, along with student fund or pride student funding from various restricted funds, the Medical Alumni Association provides the awards to students who can travel internationally for rotations and service projects. In addition to our student programming, the Medical Alumni Association also hosts 10 to 15 residence and fellow events each year, as well as the Medical Alumni Reunions Weekly. In addition to all our student and alumni programs and events, the Medical Alumni Association generously provides scholarships to our medical and nursing students. And this year, the association was able to provide close to $1.1 million thanks to the generous contributions of the medical school graduates that came before you. A Facebook group for the class of 2017 and for incoming and current students to post is available for housing orientation and other plans. We also support both web-based and print social media, including websites and our alumni magazine Bibles for continued interaction with the graduates. Importantly, we also support future reunion weekends, where every 5 years you get to remember more than you think you would about other folks in your class, and though you may have not changed much in that time yourself, you realize they've made a little change in themselves. My advice, your use of your white coat, is to recognize the privilege that patients will give you in allowing you to care for them. Your patient will be much more resistant to your treatment than you imagine. They will recover or won't recover with or despite your advice and treatment, but they will always appreciate your care. One other advice, don't overstuff the pockets. We, the Alumni Association, do this for our love of medicine and for the superb education we received for so many years and decades, and support each of you in your journey at the university. My predecessors, the other presidents before me, have told the incoming student class that they would personally contribute $5 to the Medical Alumni Association for every medical student that contributed, and to set an example and create an environment of giving back to the class of, just to give you an idea, the class of 2013, final participation rate was about 85%. And having done the math, and to make this a white coat ceremony tradition, my wife, who doesn't know yet, and I will agree to a $10 per student donation, and want to continue this year. So we hope that the class of 2017 will hear the call and And even now as you begin, consider what you will do to help those that follow in your footsteps. Your Alumni Society and your future patients wish you all the best in the years ahead.
Thank you, Mac. Also here to welcome our students today is Dr. Casscells, also from the class of 1981. Dr. Casscells has served with us for many years, both as a member of the Board of Directors of the Medical Alumni Association and currently as the President of the Board of Trustees for the Medical School Foundation. Dr. Casscells is an orthopedic surgeon in private practice in Delaware, where he also served as the President of the Delaware Academy of Medicine. His family has supported the university in many ways for several generations, and he is currently serving his fourth and final year as President of the Medical School Foundation. Welcome, President.
Thank you, Barry and Mac. Mac, my classmate, is the brains of the organization. He's a neurosurgeon. They always put the brain before the brawn, the orthopedic surgeon, just so you know what you're in for. I can't help deviate a little bit from my prepared remarks because I'm looking at this wonderful mural up here. It always takes me back. This is the era of you can see the School of Athens. Nowhere in that picture is Hippocrates, much less Aeschylus. And that's because Aeschylus and Hippocrates came a long time before this era. This is somewhere around, I'm guessing about 300 BC. I could be a little wrong, but you got to go back farther than that to find Hippocrates, and then you have to go, and Hippocrates was an 8th generation worshiper of Aeschylus. So we'll get to a little bit of that later on. Anyway, as you have heard from Dr. McCrary, the Medical Alumni Association, which is the functional side of our organization, does a host of things here at the medical school, from building buildings to funding scholarships to programmatic things to education, continuing medical education, all sorts of things, including the white coat ceremony. To be clear, the foundation is the side of the organization that raises, nurtures, and provides those funds. So that's the difference, just to clarify things. It's important to note that we're supported by fully 70% of the graduate physicians. As an institution, the medical school alumni of the University of Virginia pay it forward. As such, I come before you as a beneficiary of the Hippocratic Way, which obligates the student of medicine to educate the child of his teacher. My father was an orthopedic surgeon, trained by my godfather, Alfred Shands Jr., the father of pediatric orthopedic surgery and the founder of this organization, and the son of one of the first orthopedic surgeons, Alfred Shands Jr. I've been educated by the students of my father and godfather. The UVA Medical Alumni Association and the Medical School Foundation were founded by these great doctors, and you are here in no small way because of their greatness, forethought, and generosity. Today you don the mantle of that responsibility. The white coat is one contemporary symbol with many curious histories. I'm here to tell you that today the white coat means skill, knowledge, truth, honesty, charity, and tireless energy. The staff of Aeschylus, another symbol, which is the snake on a stick, is the iconic symbol of medicine and refers to a surgical technique that ended a plague of worms driving out the snakes. You may have heard that phrase. It is referenced in stories of Moses, Jesus, Mohammed, and St. Patrick. While often distorted, such as the caduceus seen in the military, which conflates some other symbolism, the importance behind the symbol remains. We drive out disease. Make no mistake, the symbolism matters because you have chosen a life of service, a calling. If you think otherwise, you need to rethink. The road ahead of you is difficult and more gratifying than anything you can imagine. If you understand, and if you are deserving of the grace of serving others. 2 nights ago, I spoke with my son, who is in his first year of orthopedic residency. I cannot describe to you the joy of our conversation. Both of us exhausted from very long hours, but with our mutual love of medicine. It reminded me of conversations with my own dad way back when. Remember, those who teach you expect you to teach. Those who support you in your education now expect you to support those who follow you. You will be given much, and in turn, much will be expected of you, and that is the great blessing of our profession. Welcome into the great, ancient, secret society of Asians. Thank you.
And now I'm very excited to introduce you to the Dean of the School of Medicine, Dr. Nancy Dunlap. A pulmonologist, Dr. Dunlap comes to Charlottesville by way of Washington, D.C., where she was a physician in residence with the National Governors Association Center for Best Practices. Dr. Dunlap received a Bachelor of Arts